Hello, we are back with another episode of BioNexus Health Podcast series. Today, we will be highlighting Lyme disease and mold biotoxin illness. And today we have Linda from right here in New Jersey. Linda will be joining us and highlighting the benefits of a completely herbal approach to tick-borne infections and mold biotoxin illness, which also includes chronic inflammatory response syndrome. So let's proceed and welcome Linda to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
What brought you to BioNexus Health? What made you decide that you would like to pursue a completely natural, plant-based herbal approach for all of your chronic conditions? And if you wouldn't mind telling us, what conditions you were dealing with.
So initially, I think I'm looking back probably 5 or 6 years right now, and I was sought out. I was given a Lyme test by my doctor. I had significant joint pain and went to the doctor and was explaining this, and I was told that the possibility was Lyme, and they sent me for x-rays. I had pain in the knees and so forth. And what was really interesting is I have a little bit of a background in medicine, but I never really truly pursued it. I went through nursing school and pre-med, and I went back to the doctor after the test was taken. And, according to the test, I didn't have Lyme disease back then, but yet I said to the doctor, what was how did the x-rays come out? And she said, well, you have water on the knee, which I thought was strange because there was no injury or anything that took place. And then I said, what should I do? And she said, well, let's just watch it and make sure it goes down. And then I said, well, what about the other x-ray? And she said, well, I forgot there were 2 x-rays. They went and got the second x-ray and reported back to me that I had water on the other knee. And I kind of right then and there said, something's wrong here. It's one thing to have it on one knee, but you have water on both knees. And
you mentioned there was no injury that caused this.
No.
Right.
No. Right. And the other thing now, looking back, I grew up in Connecticut, like 20 miles away from Lyme, Connecticut.
Oh, there you go. Right.
And this is an interesting story, especially about the knee. When I was a child, periodically my knees would swell up and become inflamed and hot. And I mean, I'm talking 7 or 8, 9 years old. And back then we'd go to the doctor, and the term they used to diagnose me was housemaid's knee. That's what they used to call it back then. And so I would ice it and do whatever it was that they told me to do. And so I guess in retrospect, there's this information finding journey that you go on. And all along the way, hopefully the right people are put in your path. And it might take years, it might take decades to integrate all this information. But if we're paying attention, eventually for me, when I stood in front of that doctor, I said, my conclusion is there's something wrong here. Like the information I'm being given isn't necessarily matching what my experience is. And after that time, I had, experienced some traumatic events. I lost my business in a hurricane, and as time went on, what had happened to me was that my symptoms started to become a lot worse.
So wait. So this doctor did not really treat you for Lyme disease at that time?
No.
Okay.
No.
Okay.
No. It was just the path for me to come to the awareness that that's where it started. Like,
right.
Actually said this could be Lyme disease, and then when the test, no matter what I was presenting with, when the test came back, they were kind of like, well, the test says it's not Lyme disease, it's not Lyme disease. but at that point with me, it planted the seed where I said, something is definitely wrong here. And just the introduction to the concept of Lyme disease for me made more sense than anything.
Right.
With regard to the symptoms that I was presenting. And so after this traumatic event, I was able to piece together that my immune system had taken a significant hit because of the nature. I had a restaurant, it was on the coast, and we were involved in a hurricane that had completely, like there were 11 feet of water in the building. And
11 feet?
Yes.
Was this Sandy?
Yes.
Ah, right, okay.
And my business partner had a pretty compromised, she had asthma and some lung complications. So I kind of decided that I would be the one to supervise and take part in the cleanup. And, even subsequently understood that my exposure to the bacteria, germs, everything that had been swept up in that storm and left in that building that I was working in, I had such a huge hit and exposure to mold and all types of bacteria that was to precede the next event. My immune system at that point was severely compromised, and in my mind, I already had Lyme disease, and it gave Lyme the opportunity to just proliferate, in my compromised immune system. And the thing that I then did, because I started having much more severe symptoms, I think for me, I went to another doctor that was, termed quote unquote Lyme literate. And there was some testing done, probably some more sophisticated testing. And again, it was, you may have Lyme, but we're gonna treat you for it anyway. We're not 100% sure. It was still really at a time when the testing was just very non-specific. I mean, it just seemed like there wasn't anything conclusive that came from testing in my mind.
It still is, Linda. It still is very out there, inconclusive, no matter how expensive the tests. It's just, they say, sometimes it's just the luck of the draw. So.
Right. And I, again, I felt comfortable saying, obviously I have all these symptoms. I had, my brain involvement was so severe at that point that my brain couldn't even read signals properly. If I was driving down the road and came up to a stoplight and it was green, I could sometimes stop at a green light, and I'd find myself sitting at a green light and wondering, why didn't my brain tell me to do what I was supposed to do? There were times when I would tell my brain to make a right-hand turn in the car, and the car would turn left, meaning my brain was misinterpreting signals. One of the things that I did consistently when my symptoms got much, much worse is I'd come in the house at night and leave the car door open. Oh. I'd have a neighbor call and say, Linda, your trunk's open on your car door's open or whatever. My short-term memory was obliterated. It just, I owned and operated two businesses, two of them simultaneously for 22 years, and, food business. And I obviously was a very, adept at
multitasking.
Multitasking. And I could not complete one task, no matter how hard I focused or concentrated on it. And I, at that point, sought out medical care. And the gist of what that entailed was to do what at that point was considered or known to be successful. And there just seemed to me to be this, I don't know, almost like a group, if you will, of physicians or people in the area that had adopted, the traditional technique for treating Lyme, which was antibiotics.
Antibiotics, yeah.
They had maybe bought into some other protocols, maybe parasites were certainly focused upon at that time. And they were doing very, very minimal work with herbal products, maybe like a couple of things that were known to be helpful, but there wasn't any real conviction at that point. It was almost as if they were kind of finding things that, you know, they may have heard were helpful, you know, and then you also had these supplements that were recommended at that time. Total, I was on antibiotics for, I believe it was, I think Dr. Dashore, I looked before I began the podcast. My first appointment with you was in January of 2017. So I'm fairly certain that I was on treatment, antibiotic doxycycline for several years, at least 2 years.
2 years, okay.
Yes. And I was, you know, doing, I think it was Tindamax. I was pulsing Tindamax and a few other things. And I had not really achieved what I considered to be, you know, recovery. I was still having all the same problems that I had when I came in. They were muted to some extent, but I also know now that the exposure that I had to the use of antibiotics was certainly compromising my gut. My gut is compromised to this day. And, you know, there were so many other areas of my, you know, me physically that were, meaning there were so many more things that were added on by the use of antibiotics, and that my overall recovery for the purpose that I went initially wasn't significant. And basically the way I was led to you is we attended I think it was a conference locally where there were a number of different practitioners that spoke at the conference. And, and I'll be honest, when you got up, I didn't understand a word of what you said. I felt like you were speaking a foreign language, and most of the people in the room, honestly, you lost their attention because they didn't have the slightest clue what it is that you were doing. And actually what you were proposing at the time, from what I recall, was a total and complete life change, a change in absolutely your perspective on just about anything that you were doing in your life at that time, and how that was really necessary in order to achieve, you know, recovery, or even just to gain traction against what it was that we were dealing with.
Oh, okay. So yes. I remember that conference. You know, I spoke, my son spoke as well. And I was speaking about how it is essential, you know, for diet, lifestyle changes, you know, calming down your stress, being kind to yourself, right? You know, people, I understand what you're saying because, you know, people think it's an infection and you take medication and voila, you're done, or you should be done. But, you know, back in the day, it was still early days where people were just beginning to understand, or did not understand, how deep Lyme goes into your system, and that there are always co-infections. You know, I've had many people, patients come to me that have been on antibiotics for a couple of years, just like you were. However, only for Lyme disease. Co-infections were not looked at, you know, and any other biotoxin exposure, just like you so obviously had biotoxin exposure, that wasn't looked at. Yes, so I remember speaking about all of that because we had to go through an extremely traumatic journey ourselves, you know, recovering my son and myself, you know, from fibromyalgia, borderline MS, chronic fatigue, all of these diagnoses, which are just thrown at you, you know, anxiety, depression, like really, like, you know, my whole life, this has never been an issue. And now all of these come all together. It's just, right. So I understand. Okay. And what you were like, you know, I'm never, I don't understand this lady. And, you know,
and, you know, I think, I believe, and I'm fairly certain that the only other co-infection that was detected, which was significant, was Babesia. And I was treated pharmaceutically for Babesia, and we were tested and we did detect Babesia. And I was also given the clean bill of health for Babesia.
Okay.
being treated by an MD. So again, I had layer upon layer upon layer of things that were going to take years for me to detect and understand, and my recovery process was very, very complex and convoluted just because of that. Because as soon as we found one thing, there was something else, and I'm getting ahead of myself right now because that wasn't with the MD that I went to. So what ended up happening to me, again, it was like the situation with the knee. I was being given tests and blood tests, and they were, now I know why they're being given. One of them was, I remember, was the VEGF, just off the top of my head, or I think it's VEGF, but I was given these tests, and I remember that I was trying to make an appointment to go back to the doctor to get the results. And one of the things that I grew to understand at that point, and the doctor readily admitted it, is that she didn't know how to interpret the tests.
Mm-hmm.
So now here I am, and I'm being given these tests, and I'm stopping, scratching my head and saying, what am I doing here? And I knew I had just reached the end of the road. I just knew it. And so we attended this conference, and I think the other thing that happens, and I allude to the fact that there is brain fog involved. When I was at this conference and listening to people, I could understand some of the medical aspects of what people were talking about and treatment and so forth. But again, your brain and your concentration and all of those, parts of our brain are compromised in a way that even if I understood what you were saying, I did not retain it. And, I could take notes and I could do all these things, but there's so many things that happen to your ability to, restore, retain, even process information, that made it so hard. Even if you have somebody that's competent in front of you, you just wouldn't even know it, because, that part of it, there's so much information that you need to learn and understand and grasp, but yet you
process,
compromised ability to do so. Right. And that part for me was daunting. You couldn't read and understand what you were reading. So the thing that happened, it wasn't really my choice. It was the person that I attended the conference with said to me, if I was going to have somebody treat me, it would be that person. And that person was you. And I'm thinking, that's the last person I would go to. I didn't understand. But yet I did, again, I was open to understanding that maybe on some level, what you were saying, to me, it wasn't necessarily easy. I was looking for something. I was looking for a cure. I wasn't looking for a change in lifestyle on top of all of that, which I had already endured, and so I think for me, that deterred me. But ultimately, when I was given that, kind of push, that's exactly what I sought out, and I do remember coming to you and walking into your office. And ironically, the same person that pushed me to go see you, when we walked into your office, you looked at her and you said, you have Lyme disease, and I think for me, sometimes we're put in the right place at the right time, but you were able to see that she had, the signs of Bell's palsy, which is a pretty prominent sign with Lyme disease. And she just stood there flabbergasted, like, what are you talking about? And frankly, I go for my appointment and half of it's about the person that brought me in there. But I really believe to this day that sometimes that's how we get to the place where we receive what we need with regard to especially Lyme disease, because there's no traditional route or method for treatment or finding a practitioner or doing any of the things that you really need to do to achieve wellness. And that being said, I do remember that when I did have that appointment, you said to me, I think I can help you achieve, I think you said something like 90-something% recovery. And I sat in my chair and I said, I thought in my head, that's just ridiculous, because maybe I had achieved 50% with having worked at this. And I even started doing my own research while I was seeing the MD. I didn't tell the MD, but I had already started using cat's claw. I already started using herbs in conjunction with the treatment she was doing,
Okay.
really out of frustration. And when you said that to me, I thought, that's ridiculous, because even anything that I had already tried in my mind was not taking me to a place that was helping me to at least experience that I even felt like I was getting to a place of recovering. I felt like I was fighting a losing battle.
I remember your first appointment. I also remember, energetically sensing as well as symptomatically sensing in your friend that she had Lyme disease as well. So that was, yes. And like you said, the universe brought the two of you to me together for a reason. And yes, so that your journey to health and wellness and the absolute privilege of helping you on that journey would be mine. So we did extensive additional testing, and then we started on a very comprehensive, structured step-by-step herbal protocol, and you started feeling better. Can you walk us through that?
I mean, I can honestly say that when I was in the real throes of being really ill with Lyme disease, I would wake up every single day and I would say, what is the point? Because I had gone from this very, very active, vibrant, successful, accomplished, person to someone that could just barely get out of bed and function. And I thought to myself, what is the point? And if I'm going to live the rest of my life this way, and I've already spent years and, with the help of supposedly the best person in the area of treatment. And I was just beyond frustrated and felt like, I really felt discouraged. But, when I started treatment, and I think for me, anything that I do, the explanation or the understanding or the reasons, they do need to resonate with me. And I think, we did testing, and we found that I had a number of different things happening. And that's just on, bacterial or viral or, we were talking Epstein-Barr, we were talking Mycoplasma pneumonia, we were talking 2 different strains of Lyme, the typical strain, and I think the other one was recurrentis. And I was told, well, you probably picked up one strain of Lyme, here on the East Coast, and you probably picked another one up while you were traveling. And now I'm thinking, oh, great, I'm a Lyme overachiever now. This is really wonderful. And then we went from there to really establish the complexities of the bacterial and viral load. And I would say the total and complete disruption of my equilibrium. I mean, even when I initially went to the doctor, the first doctor I went to, my white blood cell count had been elevated for every single blood test I had for probably 3 years. I had an elevated white blood cell count.
For 3 years?
Yeah, well, the whole time I was on antibiotics. And I think, again, my blood pressure was lower than normal all that time. Mm-hmm. And I had never, ever seen stabilization in my blood testing or anything. And all these things went from being completely normal my whole life to all of a sudden out of whack. And I think I remember you laughing at me because you said to me, well, you have, this, my feet, every time I got out of bed, my feet, it was never really established whether or not I had Bartonella. But I had all this weird stuff that happened. I mean, I had plantar fasciitis and I had all these things happening simultaneously. Mm-hmm. You kind of laughed at me because you said, well, what did you think was causing this? And I said, I just thought it was old age. And you said, well, old age comes on in several months kind of thing. And you laughed. And it's true, because we in our minds try to rationalize what's happening because we have a very, very limited scope and virtually no information as to what is happening with regard to Lyme disease, especially if you're looking in mainstream media or looking to traditional sources for an understanding.
Right. Right. I would agree with you there. Yes, I remember. I remember you mentioning old age, and you weren't even that old. Like what? No.
No,
So, right.
but
It's
again,
interesting.
your reference point for life or physical health at this point is so skewed because the
Yes.
advance is so rapid. The level of compromise is so extensive in such a short period of time. Your brain scrambles to find a reason, but yet, anything you can come up with is it's foreign to you. This whole thing is very, very foreign to us. And if you haven't experienced it through someone else having it or a story or whatever, and you're starting from scratch, which essentially I was, nothing makes sense, even medically, it doesn't make sense, So I think for me, bit by bit by bit, we kind of started peeling away the layers. And I was to find that my recovery wasn't not instantaneous. It was long and it was tedious and it was frustrating. And there were times where I was skeptical. There were times where I was just questioning what I was doing. The other thing that happens, I believe, is, there's certain places you can go to find information once you're dead, once you start treatment or you gain a better understanding of what's happening. And then you immerse yourself in that. And that's, again, a lot of it is very, very valuable information, but you can very, very quickly overload yourself with all of the things that are out there that, if you do dig deep enough, you can find. And I do think for me, I probably would have been semi-successful had I started to do all those things myself. But there was, and again, I have a medical background. I have an understanding of how these things work. But it was abundantly clear to me that without having the guidance and the perspective of a practitioner, that I probably would have ended up making myself worse, even with the best intentions. I learned that you treat this in layers. I learned that there's certain treatments you have to do first, because if you don't, then you're really just missing the point, and I learned, we did parasites, we did, we did tinctures, we did homeopathic, and homeopathic is something I never even believed in. I just, again, it's not something I had fundamental knowledge in. And I thought, what is this clear liquid that has this name on the bottle going to do for me? And yet, relatively quickly, I started to understand that the integration of support, which is a total foreign concept in medicine, homeopathic support, any type of support for the organ systems, the body, any of that, for me was, again, totally foreign. When I had dealt with disease prior to my experience with you, I was given something that made it better or made the symptoms go away. And that was the basis for my knowledge. It really didn't go beyond that. I mean, it did to some extent, but especially in dealing with this disease, I think that was crucial, that understanding.
Sorry, I'm glad you mentioned something about, taking a pill to make the symptoms go away, because when it comes to Lyme disease, co-infections, biotoxin illness, one has to get to the root cause and treat everything in stages. And because of your medical background as well as herbal background, it was an absolute pleasure being able to guide you step by step. And I think this time you actually understood what I was trying to do and the approach I had, because not often do you find labs always correlate to the kind of symptoms that you're experiencing? Like you explained to me your leg issues, and it was very clear to me that it was Bartonella, whereas your labs were not picking up. And when you have infections that suppress the adaptive immunity, not enough antibodies can be produced to be detected in labs. Nowadays that is a little bit better known. to practitioners, and I'm not saying just Lyme specialists, overall practitioners are getting the hang of it a bit more. Now, had you ever considered that hurricane or Superstorm Sandy caused mold biotoxin illness or chronic inflammatory response syndrome for you? I don't think you had researched that, right? I had to go through that with you. The markers, the mold.
I've had a couple of very interesting, again, if you're going to the right person, very often you'll get the right answer.
Mm.
And I've had that experience numerous times. I mean, there was a period of time when I went to a respiratory therapist. I had asthma, I had gastric reflux, I had all these things happening to me, and he was very, very knowledgeable. And he pretty much helped me to understand that if I stopped consuming dairy, he said, these things will go away. And I thought, that's crazy, and I did, and I never had another allergy shot, and so again, this is more about the layers. And, we may not get all our answers in one place. And I think the other thing about Lyme disease is, the one thing I grew to understand about it is that it's going to the weakest part of the body. When a bacteria invades the body, or any bacteria or microorganism, it's gonna go to the weakest place first. And so, I began to understand, developing this knowledge and concepts and understanding that every person is different. And I grew in this understanding, and from that, we started talk about, and I knew that Lyme, has its own, biotoxin contribution, and, we talked, how are you, getting rid of these toxins in your system? And I mean, then you open up this whole other can of worms, like, how are you doing this? And then you understand you start with Lyme, and then you go on to everything else under the sun, as far as what is compromising our body's ability to stay alive, especially if you have this primary infection, and then you're trying to look at the layers on top of it. As far as the mold is concerned, we discussed that I had throughout my life some pretty significant events that contributed to my overall mold exposure, even prior to Superstorm Sandy. I think that Superstorm Sandy was just the overall blow that kind of brought everything to a place where my whole entire system was compromised.
That was your tipping point right there, right? With the tremendous load of exposure, with 11 feet of water, and having to evacuate and clean up and deal with the whole situation.
I think for me, the one thing, and I mean, without to be graphic, is it's raw sewage. I mean, the water is mixed with everything. When the water disappears, it's depositing anything. So you have sewer lines, you have absolutely everything.
All of that blew up for you. All of that blew up that day. Oh my goodness. Okay.
All of it. I mean, the whole entire town, the gas lines, every single part of the town was compromised. The entire town was underwater, and when you're in the middle of this, you don't think about this. First of all, I was in shock for months after that. I'm not thinking straight. But I think for me, with regard to mold, the other thing that factors in, which is extremely helpful, is family history,
Yes.
Even a lot of the asthma I had was triggered, but it was all airborne. It was pollutants, but it's also, again, it's stuff that we're living in, whether it's mold or dust or, and so I knew from my family history that some members of my family had a pretty strong allergy to mold. And when we started to look at it, we did DNA testing, I think, with regard to our detox pathways, which for me, I understand that. I don't know that the layperson is going to understand it, but I completely understood that my body just simply wasn't doing a very good job on its own to rid myself of these, numerous numerous things that were toxic to the body. And once I gained that understanding, again, it's a whole other layer of a wealth of understanding with regard to binders and all the ways that we treat and remove, which you could do binders first, but I don't know if you haven't addressed the initial infection. So again, it translates into these layers. When your body's strong enough, then you just go to the next layer.
Yes, and what comes first is important, which is where you mentioned practitioner guidance, which is something on my journey was, lots of ups and downs because of that. But in the end, from personal experience, you learn, before you start helping other people, one needs to establish firmly what gets dealt with in what order. And that can make or break a patient. It needs to be done, because when you start antimicrobial herbs and the patient, starts experiencing a Herxheimer or a die-off reaction, now that's good news, which means that your trajectory is good. It's on the right path, but it's important to do all of the groundwork, like you explained, organ support, etc., to make sure that the body is able to handle the beginning of antimicrobial treatment, and that you don't have a patient who is completely debilitated with these die-off reactions. So how in what was the trajectory of your improvement? Like, what improved first?
I think that and again, what's really interesting is you say improvement, and from your perspective, if someone has the Herxheimer reaction, they're improving, but to the patient, when they have a Herxheimer reaction, they're getting worse. That's the only thing that's coming into your brain is this. And if you've been treated within the medical, normalized medical paradigm that I was raised with, and I'm treated with something that makes me worse, it's not working. So that I had to get used to. I had to get used to understanding that the treatment was going to make it worse before it made it better.
Right.
That was again, it was a concept in my mind that did not make sense. But as I grew to understand what was happening, it began to make sense. For me, I think there were a number of different things that were happening that actually made it appear as though it was getting worse. I think for me, probably one of the most crucial things that was probably helpful for me in terms of my recovery was when I believe I had significant brain swelling. I couldn't even put a hat on anymore without experiencing tremendous discomfort. I couldn't wear a shirt that was around my neck. It created it just was very, very uncomfortable. And I believe one of the first things that you did was try to help me detox my brain. And the other thing that I've grown to understand and attended lectures and everything is that there's a significant correlation even between mental illness and the symptoms of mental illness and brain inflammation, as well as all of the other cognitive impairment that takes.
Absolutely. Yes.
So for me, I was experiencing a lot of that, even in the form of depression that might be associated with the illness could have very easily been attributed to brain inflammation, because when Lyme attacks the body, it's not selective. It goes to every organ.
Right.
And so for me, it was probably a long period of time, and I did experience relief from some of the physical symptoms I had. I did start to notice improvement in my cognitive ability. I did start to notice that, again, it might just be, we're talking about progress, but I started to notice the correlation between what I ate and how I felt and what my moods were. So again, if you're eating something that's causing inflammation, and here you are, frantically trying to reduce inflammation in the body or in the brain, and you're eating sugar, well, nothing's going to work,
Right.
So again, it's tying in these ideas and these lifestyle changes. And in order to recognize recovery, that's where I began to understand the necessity of the lifestyle changes across the board, so that you weren't undoing essentially what you were trying to do with whatever treatment you were applying in each situation. So it was kind of like fits and starts. It wasn't immediate. The Babesia, like I noticed immediate improvement when I could breathe again,
Right.
I noticed that with the treatment that I was doing and being introduced to, a consistent detox program, brain inflammation, my head literally went down a hat size. I mean, there were just things that had happened to my body that I didn't understand, probably didn't even recognize until they were treated. I think I had a headache and I was having migraines for years and living with it.
Mm-hmm.
Like normal occurrence for me to wake up with a headache. And so for the first time in a very, very long time, I experienced life without headaches, and again, our bodies are capable of withstanding a tremendous amount of discomfort and, also pain that we live with, and we might, take Advil or aspirin or Tylenol. I mean, that was a normal thing for me to be taking Tylenol every single day, and that was part of my normal routine for having headaches.
I've heard that. Yeah, I've heard that from many patients. It just becomes a part of your normal that, hey, I'm someone that has migraines and headaches and pain every single day. Yeah.
There are a lot of things that hung on for quite a long period of time. Exercise fatigue. I mean, I was fatigued so easily for so many years. It just, physical discomfort. I lived with physical discomfort continuously. And a lot of it, again, was that my body was so compromised with so many different things that were happening at the same time. I mean, really, until I got a handle on mold, I really think that was just wreaking havoc. And I didn't even really truly understand the complete level of exposure that I was experiencing until I really did get on a very, very consistent protocol for removing mold from the body, And again, we might be given something to take, a binder and told how to take it. But if you're sick and you're taking 15 other things, and then you're supposed to be taking this over here consistently, and that you're dealing with so many things, then you're like, you might not be on a consistent. But, when I did get to that place and I was in a greater understanding of the impact of mold on my body, and then I started to do what I needed to do to remove it or take the necessary medication in order to eradicate or to remove it from the body consistently whenever I had exposure, then I could more easily understand. I knew within seconds, whenever I went into a building that had mold in it, I could identify it immediately. Whereas I'd lived my whole entire life and been oblivious to the fact that my body could not get rid of mold.
Right. Genetic predisposition is what we discovered in you, correct? Yes, you had genetic predisposition for mold, which means that your body cannot identify, tag, and detoxify mycotoxins, right? Good. So you were improving with your headaches, migraines, your endurance, aches and pains. How about your business?
Well, I think that what I began to understand really was that there's a direct correlation between the condition of your body and your ability to perform, and at this point, I'm going to say my initial diagnosis, I was in my early 50s. So again, I had reached that milestone and I said, oh, this is what old age looks like. Initially that was my rationale. But what I started to understand was that, there were areas that improved, and sometimes they improved so well that I was functioning better than I had prior to my initial understanding of the infection, in terms of the way that my mind was working or processing and so forth. I began to understand, because of the whole integrated approach, when my body was in a very kind of a cleaner state, or I was applying most of the principles that I knew I needed to do. I mean, everything from, again, we're looking at pollution or exposure to pesticides or EMFs or this, that, or the other thing.
Right.
Again, I'm looking at even things outside of Lyme now, and I'm saying, how do I reduce my exposure to mold especially? And I found that when I was really using an integrated approach and reducing my exposure and supporting my body, that my body was functioning better than it had even before I sought treatment in some areas.
Yes, even before you thought it was old age.
That's right.
Yeah, wonderful. Well, I'm glad that you are feeling better, that you are you able to multitask again?
Unfortunately, yes.
I like how you put that. Okay.
I think the journey is one, and I've heard people say it's emotional, it's physical, and it's spiritual. And I think that having I'm still in the journey, obviously, but having had this experience, it has made me so much more aware on so many levels, with regard to the way we live our lives today. And one of the things that I am really supremely aware of is that if we expose our bodies to stress of any sort, emotional stress, physical stress, and stressors, I think that even normal functioning people are experiencing in this day and age a pretty significant compromise of their health and their well-being and their ability to function. So for me today, I'm joking about being able to multitask because I'm keenly aware, and I have this bar that I'm constantly just kind of in the back of my mind aware of, is pushing myself beyond my limits, and how that impacts me psychologically, how it impacts me physically, and the level of sensitivity that I have because of the nature of the infection or any of the things that I'm still dealing with. It's instantaneous that I will have some sort of a signal or a trigger that allows me to say, it's time to step away. It's time to let go. And how important is it? I've experienced and been in the depths of hell with my, where I've gone with this illness. And then it becomes a choice. When you realize you have choices, when you realize you have options for wellness. And one of the other things I'm going to go back to, which I've found, and again, sealed the deal for me, is one of my first appointments with you, I said to you, how do you keep track of this? Because you were explaining to me that every patient's different, and there were so many different aspects of the mind and our energy and our physical body that have to be and really need to be looked at and addressed. And your answer was, well, I have an algorithm in my head for each person, and to me, if that was a quote that I would apply to you or Lyme disease, that's the one that I would use, is that each person has a completely different fingerprint, with regard to what it is that needs to be looked at, what their weaknesses are, and for me, that is essentially how I live my life today. It's with a better understanding of what my fingerprint is and what's going to work for me, what I need to pay attention to, and what are my, red flags that tell me, you need to stay within this realm of your life and this level of comfortability. And the minute we step outside of that, we know that we're going to experience repercussions or discomfort of some form,
Yes. Well said, well put. Yes, each patient has their unique algorithm, which has to be determined, calculated even properly, so that a completely customized protocol can be created for each patient. And it is very much possible to do that on a plant-based herbal approach because combining herbs, the dosages, it is quite possible to make individualized preparations. Even if you want to further up that, then you can incorporate frequency medicine into that as well. Drop in some quantum physics into that as well, quant biology. Okay, well, so I truly appreciate you taking the time out to come and speak with me today. I think this will be helpful to so many listening because many will be able to relate. You're a patient with Lyme co-infections, mold exposure, just like myself. And, our journeys have had many similarities too, with respect to symptoms and lifestyle changes that we had to incorporate and establish the new normal for ourselves. Yeah. Well, many, many blessings to you and your family. And, thank you for being here with me today.
Thank you. I appreciated being able to discuss this.
Informational and educational for those watching. Linda has had an interesting journey with lots of ups and downs in her recovery, and I'm glad she is, fully functional, has lots of energy, that her business is thriving, and she is in a much better place in life right now. So I look forward to seeing you in the next episode of this podcast. Until then, be well and namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.